One of the supplements that we have on our list as being so critical for everyone is fish oil. The two fatty acids in fish oil, the important ones, are EPA and DHA. EPA increases blood flow to the brain, probably a good thing, and DHA decreases inflammation. If you look at all aging as inflammation and in many cases a reduction in blood flow, that's a perfect anti-aging drug. And your brain is 60% composed of EPA and DHA, so fish oils are critical for everybody. And the omega-6s, which are bad news, like things in egg yolks, displace the omega-3s in your brain. And a lot of people are short of omega-3s. Omega-3s are anti-aging, particularly brain aging, so everybody needs more omega-3s. We now have a test where we can actually test your omega-3 levels. That's a pretty new development, so that's important. There are lots of brands of omega-3, and what I tell patients is, look in the front of the bottle, and the bottle may say there's 1,000 milligrams of omega in here. That doesn't count, because when you turn it around, you look at the back of the bottle and you look at the components, how much EPA plus DHA, what does that equal? And often, out of that 1,000 of fish oil, it may only be 700 milligrams of EPA plus DHA. That's what's important. You need 3,000 milligrams a day. So if the tablet has 700 in it, you take 4 a day and get to 2,800. They're all different brands. One of the best brands is Brain Armor. And not only do they have the omegas in here, but they'll often have vitamin D and some other important products. There's a recent study that Brain Armor did with the National Football League. So all the players in the National Football League and pro athletes are worried about CTE, chronic traumatic encephalopathy, which is really an early form of dementia. And they showed a huge 84% reduction in inflammation in the brain on their brand of omega-3s and the other components. That's probably going to prevent CTE in athletes from now on. That's a huge problem. If that prevents CTE in athletes, it probably is going to help prevent Alzheimer's disease and other dementias. So the omega-3s are incredibly important. They're anti-inflammatory in your brain, they're also anti-inflammatory in your body. We see a lot of people in our clinics, and in the women's clinic, estrogen's a big-time anti-inflammatory, testosterone in the men's clinic is a big-time anti-inflammatory. In both clinics, when we've had them on their hormones and their supplements, most of the supplements are anti-inflammatories, we've had people say, I canceled my joint replacement surgery. Well, what did you do that for? My pain all went away. Or my shoulder hasn't healed for 2 years, I went on the hormones, the supplements, and it healed. Yeah, because you're increasing blood supply and decreasing inflammation. Those are healing things, and they're also anti-aging. So a major portion of what we do is getting people on the omega-3s, and we'll be testing their levels now to make sure they're optimal.